When palpating the pulses of the lower extremity, we have two important pulses at the ankle, one at the knee and one at the hip. The two important pulses at the ankle, the first one is the tibial pulse. The tibial pulse, or the tibial artery, runs posterior to the medial malleolus and then down into the foot. And so we are going to palpate it just posterior to the medial malleolus and slightly superior, using again the pads of our middle two fingers to. Now, if I dorsiflex her, that puts tension on that blood vessel, on that tibial artery, and it causes, like stretching a hose, makes the blood not flow as well. So we want her relaxed in a plantar flex position when we palpate the tibial pulse. So I find my bony landmark, the medial malleolus, go posterior to that, and if I don't feel it there, I can come slightly superior, and there it is. The second one is best palpated on the dorsal side of the foot between the extensor hallucis longus tendon and the extensor digitorum tendon. So it will be directly on the dorsum of the foot over the cuneiforms. Now, if the foot is plantar flexed, this dorsalis pedis artery is stretched, and a lot of times we'll occlude this artery. So we want to then put this at least into the neutral position to take any tension forces off of that dorsalis pedis artery. And so the pedal pulse, we can have her simply extend her big toe, find that extensor hallucis longus, go just lateral to that, relax, and directly over the dorsum of the foot, palpate the pedal pulse. Going to the hook line position, we will palpate more on the tibia between the two heads of the gastrocnemius, bringing all fingers behind and really pulling and almost lifting the leg off of the mat because it is deep. And with all these palpation fingers in there, we're bound to hit it with one of them. That's the hope anyway. So we come in behind here, press deep between the two heads of the gastrocnemius, and I can actually feel that with my index fingers. I'm pulling significantly hard, but not quite lifting her leg off the mat. The last pulse, so that would be your popliteal pulse. The last pulse is the femoral pulse, and our landmarks are going to be the rectus femoris on the lateral side and midway at the inguinal ligament, but inferior to the inguinal ligament. And again, if we put her in the hook line position like this, this takes any stress or tension off of that artery. I simply have her lift her foot up off the mat to find my muscles and relax. I go to the medial side of that, below the inguinal ligament, and find the femoral pulse.